Very good afternoon. All gathered here. So, I'm Dr. Ramya, Assistant Professor, Department of Microbiology, Faculty of Medical and Health Science. So, today I'm discussing about parasitology and overview of parasitology. What are the topics can contain parasitology? That is epidemiology and how the host interact with the parasites, and then classification of parasites in the form of protozoa and helminthes. What are the source can cause parasitical infections, and how to collect the specimens from the infected persons, and how to transport the specimens from laboratory to diagnostic process, and finally how to diagnose and how to treat. These are the topics we can discuss in this slides. So coming to post outcome, what are the CO can focus on this topic is various types of parasites and their host, and then explain the relationship between parasites and the host and their effects, and discuss in detail about the classification of medically important parasites, and to learn about the epidemiology and preventive measures of the parasites. So coming to different kinds of parasites. First, we know about the parasitology. First, what is parasitology? The study of parasites is called as a parasitology, especially in the causes the medical implications in humans. And what is parasite? A living organism that acquires some of the basic nutrients from the humans or from some of the host. It is called as a parasites. That parasites can contact with the humans or animals for their nutritional purpose and then for their growth. So coming next, parasites may be a simple unicellular protozoa or complex multicellular protozoas. So it belongs to the eukaryotic organisms. What is eukaryotic? It's well-defined chromosomes in a membrane-bound nucleus. All parasitic organisms belongs to the eukaryotic organisms. That parasites can classified into two categories. One is protozoa and second is metazoa. Protozoa means unicellular organisms. Example, Plasmodium. Next, metazoa means multicellular organisms. It's under the helminthic types. So helminthic means worms types. So examples, ticks and lice. And next we know about endoparasites and ectoparasites. So what is the difference between endoparasites and endo means inside the cell? So endoparasite means that one specific parasite that live within the host, within the another living organism, that is called as endoparasites. So examples, malarial co-infections, so Plasmodium malaria and Giardia lamblia. Next, what is ectoparasites? That parasites live or attached to the surface of the another living organism, that is called a ectoparasites. Example, lice and ticks. So next, so coming to host, what are the host can uh, able to caused by parasites? So first, what is host? That is the organisms in or on which is the parasite lives and causes the harmful effects to the on individuals, that called as a host. Second is definitive. What is definitive host and intermediate host? We must know about the definitive and intermediate host in the parasitology. So the definitive host means the specific parasitic organisms in which the adult or sexually mature of the stage of the parasite life called as a definitive host. An intermediate host means that organisms or parasites lives during a period of developmental stage only. That is called as an intermediate host. What is zoonosis? The parasitic disease can caused in the animals that animal is considered as a host. It's called as a zoonotic disease. It includes humans also. Next, vector. So that is one type of carrier molecules. So that living carrier that transports pathogenic organisms from the infected to non-infected host, that is called as a vector. Examples, typical examples means Anopheles mosquito that it transmits malarial infection. Next, how it spread over the in our world. So we know about the epidemiology. So parasitic infections mostly occurs in globally. That majority occurs in tropical regions, which is in poverty regions and poor sanitation and personal hygiene poor conditions. That is the major impact to cause the parasitical infections. So effective preventive and control measures is that general improved sanitations, vector control in the form of insecticide, and then mass cleaning and drug administration program conducted by the regular intervals. So coming to parasitic infections, what are the major parasitic infection can cause parasites? plasmodium that is that causes the disease of malaria. That malarial disease occur in the world. 273 million people affected by the malarial disease and 1.12 million people death causes by the malarial infections. Next, soil transmitter helminth, that is worms, round worm, white worm, hookworms. It causes the pneumonitis, intestinal obstruction, and then bloody diarrhea, rectal prolapse, coughing, sneezing, abdominal pain, and anemia. So, through helminthes, 2 billion people can affected through helminthic worms, and 2 lakhs people can death caused by the helminthic worms. And third one is histosoma that causes renal tract and intestinal tract disease. It affects mainly 200 million people can affected by renal tract and intestinal disease that caused by this histosoma, and 15,000 people can 15,000 people mainly uh, affects through histosoma. And filarial worms. The filarial worms cause lymphatic filariasis disease and elephantiasis disease. 120 million people can affected by filarial worm infections. And then trypanosoma that causes Stargardt disease, especially cardiovascular disease can caused by the trypanosoma cruzi. And then African trypanosomas cause African sleeping sickness, and leishmania causes cutaneous and mucocutaneous leishmaniasis infection. So we know about next host infections. Already we discussed introductions about type of parasites and what are the hosts can affected by parasites and how it enter into our global world in the form of epidemiology. And then so the next one is host interaction, how it interact with host parasite relationship in the form of symbiosis, commensalism, and parasitism. There are three mutual interactions. Three interaction can cause. So symbiosis means both host and parasites are beneficial or dependent upon each other. None of them are harmed. In commensalism means only the parasites derives benefits from the association without causing any infections. That means the parasites can obtain the nutrients from the host, doesn't cause any harmful effects to the host. That belongs to the commensalism relationship. And third one is parasitism, always harm to the host due to the association. So if once attached with the host, it causes the harmful effect to the host. That is called as a parasitism. The parasites can't live an independent life. That type of parasites cannot live in the independent. Next one is classifications. So we know about the epidemiology and host interaction. After that, we know about the classifications of the parasites. How it classify into separate forms. So classification parasites is a controversial topic. There is no universally accepted systems. So there are two most species that causes human disease belongs to the phylum Sarcomasticifera epicam complexi and metazoa worms and the anthropodia. So based on that descriptions, we classify the parasites into two forms. One is protozoal forms and second one is helminthes. Protozoans already know discussed with unicellular. Then helminthes is in there belongs to the multicellular organisms. In the protozoas contains there are four major classifications. One is amoeba group, and second one is flagellated, and third one is sporozoa, and fourth one is ciliates. So amoeba means amoeba, flagellated, and sporozoa, ciliates. So examples for amoeba, entamoeba histolytica, that is the means of locomotion is pseudopodia movement, and flagellated through flagella uh, can move, can locate from one place to another place. Examples for flagellated protozoa, Leishmania donovani, Giardia lamblia, and Trichomonas. And third one is sporozoa. So sporozoa can't move from one to another place. So example Plasmodium species, Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malaria, and Toxoplasma species. And the ciliated type of protozoa, example Balantidium coli, that is moved through cilia, ciliary movement. And next one is helminth. Helminth, there are three major classifications: cystodes, trematodes, and nematodes. Cystodes means tap-like segmented form of helminthic worms, and trematode means flat and leaf-like helminthic forms, and nematode means elongated, cylindrical, and segmented forms. Examples for cystodes: Tania species. Examples for trematode, fascicular species, and examples for nematodes, hookworm, roundworm, and threadworms. These are the classifications of parasites. And taxonomical classifications of protozoa means protozoa is classified into four classes. One is Sarcomasticiflora, and Epicomplexia, and third one is Cilioflora, and fourth one is Microspora. From the phylum, they are divided into subphylum. The Sarcomasticiflora are divided into two subphylum. One is Sarcodina and second one is Masticophora. Sarcodina means that movement through pseudopodia movement and Masticophora movement through flagella. So examples for pseudopodia, sarcodina examples is Entaviva, that species name is Entaviva strelitica, and Masticophora through flagellated protozoas, example Giardia lambda. Second main classifications, main phylum is Epicomplexia, that is new organelle for the locomotion. So the Epicomplexia, examples Plasmodium falciparum, Pyrox, Malaria, Rodum. And third one is Ciliophora, that moved by ciliary movement, Palatidium coli, and Microspora, spore forming organisms, spore forming parasitic organisms, Enterocytozoa. So next one is classification of elements is round-worm, flatworms, then nematodes, cystodes, I already discussed. And then coming to morphology of protozoa. Morphology of protozoa, that is the flagellated, already discussed flagellated, ancillary movement, and then pseudopodia movement. So these slides mainly focused on the morphology of protozoa. So Sarcomasticiflora, Ciliophora, and Epicomplexia structure. Next, important intestinal protozoa. What type of protozoa can cause infections in the, especially in the intestines? That is transmitted by fecal oral route. That causes mainly in the diarrhea infection. So first one is Giardia lamblia, worldwide distribution that live in the human small intestines and result in the malabsorptions. Second one is Entaviva stellatica, may invade the colon and causes a bloody diarrhea and amoebic dysentery. It also causes amoebic liver abscess also. And third one is Cryptosporidium parvum, that more prevalent in the immunocompressed patients. And then fourth one is Cyclospora, and that parasites can cause small intestinal mucosa and causes diarrhea for several weeks. Next one is Palatidium coli, that large motile ciliated parasites that live in colon of pigs, humans, and rodent that lead to the colonic ulceration. And the enterocytozoans, that microsporidium, that type of parasites also common in the commonly affects the immunosuppressant. Next one is life cycles. So, is already discussed the classifications, post-introduction, epidemiology. Next, we have to know about the life cycles of protozoa. So, in the form of Giardia, there are two forms. One is cyst form, and second one is trophozoite forms. Cyst forms presently present, and that cyst form of Giardia present in the environment after entering in the human intestines in the form of trophocytes. That only causes the infections, intestinal infections. Second one is cryptosporidium. So there are two oocytes, sporocytes, and trophocytes forms. Oocytes in the environment, oocytes form in presence in the environment, and after entering in the through contaminated food or soil or water, that sporocyte form enter into the trophocytes in the form, and after asexual cycles in the human intestines, it causes the major intestinal infections. Third one is plasmodium. So plasmodium malariae can do the life cycles in the form of intermediate host. One is host and one is mosquito, second one is humans. In mosquitoes, microgamete, ookinete, and oocytes, after it enter into the humans through blood. So they form that sporocyte enter into the humans, the forms the hematocytes and zygote that causes the infections. So next one is TC fly. TC fly Trypanosoma brucei also occurs in intermediate host. One is TC fly and second one is humans. So in the TC fly there are two cycles. So there are one cycle asexual cycles. Occurs in the midgut of the TC fly and enter into the metacyclic trichomasticote in the human and metacyclic trichomasticote blood stage form. After that, it again through shedding, it enter into the environment and then enter into the T life for their reproduction purpose. So coming to symptoms. So once the life cycles the classic already over the life cycles classifications and the epidemiology. And finally, what type of symptoms, what type of disease can caused by the parasites? Diarrhea, abdominal pain, gas and bloating, nausea, and intentional weight loss, increased appetite, dehydration, chills, fever, muscle aches, rashes, insomnia. These are the symptoms. These are the basic symptoms can caused by the parasitical infections, both protozoa and helminths. And how to diagnose the parasitic infections? First, we find out the parasitic infection patients that infects mainly occurs in the intestinal digestive systems. So first we have to collect fecal stool samples. Then after that, after collecting fecal stool samples, the cyst and ova can identified through microscopic examination. Second one is endoscopy and colonoscopy. Third one is blood test for the antigen antibody detection test. And finally imaging examination through CT scan. So next one is, so symptoms after the diagnosis, then only you go for the treatment purpose. So through pharmacology basis, okay? So we have to recommend the drugs for the treatment purpose. So anti-protozoal drugs, examples chloroquine and then humantin, anti-helminthic agents, bleach, and albendazole, anti-scabiatic creams, clease, and element. These are the drugs can used for protozoal infections. Next, preventive measures. What are the preventive measures we can adapt to prevent the parasitic infections? First one is washing your hands, and then hygienic measures to be followed for the and clean up dogs or cat, disposing it properly, and following safe food handling process, and keeping your pet up to date and on veterinary care and vaccinations, and travel advices regarding food and drink in traveling abroad, taking anti-malarial drugs before traveling to regions and that have higher rate of malaria, and wearing insect sprays to prevent malarial infections. So these are the reference followed for the specific topics, and then based on that, so we can assess in the form of what is ectoparasites and what is definite host, and the examples of definite host, and name any two malarial infective parasite, malarial infection causing parasites, and what type of minor questions can uh, present through these topics. Explain briefly the various types of parasites and host and morphological forms of Giardia. Thank you.